Hey guys, Dr. Scott Leslie here. This is my first video I'm ever doing. I shouldn't say that. I've been doing videos for my students in osteology, kind of a show and tell. I've decided recently, because there's been a lot of things going on I've been observing in the media, social media, even things with patients over the course of 25 years, that I really want to document myself. I don't plan on being a YouTube sensation. I'm not looking to make money off of YouTube or Instagram. But I really wanted to document some things. So some things are, I just want to have as information for my students. I may post this on websites, Facebook boards with my patients, and maybe just general comments that I make about things I've seen in the media, like stretching or ice pack, cold packs, philosophies in training, philosophies in injury, maybe even insurance things, co-pays, deductibles, things. But I'm going to kind of keep it on the layman's side for the most part. This is not necessarily going to be clinical talks too much, but there's a lot of things that partly have bothered me. Partly I just feel like I want to document myself and just clear the air. Can't guarantee 100% of you are going to agree with 100% of what I say. But today, what I want to talk about is something that comes up a lot in my office here. Is why do we recommend to patients to come in 3 times a week? Why do we tell them 3 times a week for 4 weeks and 12 visits? And not just me as a chiropractor, athletic trainer, or physical therapist go through this, medical doctors go through this, and it drives us absolutely bonkers when we do not have compliancy. We have patients who come in, they've injured themselves, maybe acutely, they were lifting something, for example, they strain their low back. We evaluate them. We say, thankfully, there's no major damage most likely, but there's probably a strain. So we got to start a treatment plan. And in this video, I'm not going to go into the specifics of what we do, but we do tell them, hey, you're in this acute stage of care. You just injured yourself. There's some inflammation. We need you to come in 3 times a week. Now, obviously, there's 7 days in the week. All right. Now, when I worked as a student at West Virginia University, and even subsequent years when we deal with athletes, we didn't have insurance to deal with. We didn't have co-pays to deal with. So what did we tell them to do? We used to tell them, come in. We saw them twice a day, sometimes 6, 7 days a week. Okay. We know in the real world we can't do that. All right. So we try to keep them around 3 of the 7 days. Okay. To try to work on the area. Now, unlike seeing your primary care doctor, say you have an infection, you have pneumonia, they give you antibiotics, that even though you don't see your doctor every day, your treatment is take your antibiotic 1 time a day, 7 days a week. In chiropractic, and I hate to speak for physical therapists, but my athletic training degree, there's some similarities to how we treat people, and the philosophies are similar. A lot of my colleagues are physical therapists. We need to get our hands on you. You need to do exercises, okay? We only see you on 1 day, all right? And we don't see you for 2 months or 3 months, okay? We're not magicians, all right? Our treatment there's a cumulative effect of our treatment, whether it's manual therapy, stretching, modalities, that we need to see you. And most research, even though sometimes the research can be dubious, we really got to see you 2, 3 times a week to get the improvements, all right? So, especially if you've just injured yourself, you're in that inflammatory stage, which in the initial phase, we're trying to calm down the pain, make you feel better, right? That's the #1 reason why you come see us. Calm the inflammation down. Then eventually, when you get you through that first stage of care, which could be, roughly a week, 10 days, it could fluctuate if you get a flare-up. We want to go through more of a range of motion, stretching type of plan, rehabilitative type of plan. And then we want more of a strengthening plan. So it doesn't go all as seamless as I just explained it. But we want to go, the main idea is we want to go through stages of care. All right? We don't want to just get you out of pain and then you aggravate yourself 2 days later. We got to add strengthening. Okay? What happens very commonly, and why I do this video, is patients come in. All right? Now, if you get them through the first 2 days, if sometimes they're expecting in 1 visit to be miraculously better. All right? Like I'm waving my magic wand on them. Sometimes they go out of pain very quickly, all right? They just injured themselves acutely. Muscle tissue, I kind of use an image that's like cheesecloth. You tear the tissues, okay? There's some bleeding, okay? They may start getting out of pain very soon, all right? They may say, God, Dr. Leslie, you feel wonderful, or physical therapy Joe, you're doing great. okay? I don't need you anymore. I'm out of pain, all right? So what happens is they'll either discharge themselves and they go home, and we know as therapists, chiropractors, athletic trainers, that they have a partial correction, meaning that the inflammation died down, pain went away, they think they're 100%, they go on their merry way. Some cases they can get away with it, but many times what happens is they aggravate themselves. Or we know that after you're injured, there's inflammation there. There can be increased scar tissue formation. They make the area very dense. As we know with scar tissue, if you cut your leg, what is it? It can be very strong tissue, but not very elastic. There can be range of motion issues, okay? Now, pain, again, since it is the number one symptom that we see here in the office and what usually has people pick up the phone or email us, we get one of our faults as humans is that when there's pain, okay, we only think there's pain when there's a problem, okay? You could have no pain and there could be a problem, okay? It could have been festering for weeks earlier. You can go out of pain and you think you're 100%. You're like, thank you guys, I'm doing wonderful, okay? And the problem with that is there could be partial correction. You've never increased better movement, flexibility, strengthening stage of care, okay? And you discharge yourself and you really increase the risk of chronic issues. So in those 3 to 5 days a week, especially in the early stage of care, okay, we want to see you start feeling better, start creating an environment in that area that starts to heal, but then rehabilitate the area so you don't have a chronic problem, okay? We don't want you to feel good and then get a problem, because what's gonna happen? Those patients are probably gonna be staying at home going, oh, so-and-so, I felt great, but you know what? They didn't do their job, okay, because they didn't feel good. And it's really, the onus a lot of time is on the patient. It's not just coming in here, again, making me think I need to be a magician. You need to do things at home. So if we only do one time a week in the early stage of care or one time a month, you're not gonna get it, okay? So now, I know what people are thinking, and I've addressed this in my 25 years, in practice, working for companies, big conglomerates. Those of you who know me in a more mom and pop setting here in Babylon, I have worked in bigger facilities, 5,000 square feet, hundreds of people, worked side by side with doctors, and worked as administrative director of offices and stuff. And I've always encountered this with patients. They give you the look when they're out of pain, maybe you're in visit 4 or 5, okay? And they think the pain is gone. They've just strained themselves. Maybe it was like a sports injury, pretty bad, or maybe a car accident. And they're like, okay, I'm great, thank you. I don't need to make any more appointments. And they're 4 or 5 visits in, and we know they haven't healed properly. And we tell them, look, it's great. I don't want to sound like a Debbie Downer. You're feeling wonderful, okay? And that's fantastic, but we know it's only been 2 weeks, 3 weeks. You had a pretty significant injury. You need to continue. I know the number one thing that they think of is Dr. So-and-so is just telling me this because he wants to make an extra buck, right? He wants to build the insurance company. He wants to take the copay, all right? If you saw some of the EOBs nowadays in healthcare, okay, you would laugh at that, all right? And I kind of chuckle in my head that, the extra $30, $40, whatever, for 4 more visits, okay? It's not gonna make me build a house in Montauk, all right? I'm really, truly telling you this, and I tell my patients, if this wasn't a camera, that has nothing to do with that. And I usually bring back, and colleagues of mine who had worked with me, even in students at West Virginia and so on and so forth, that we would see patients, student athletes, once a day, 7 days a week, 2 times a week. Money wasn't exchanging hands because we knew that gave them the best chance of getting better and rehabilitating properly, okay? So I realize, I'm gonna say the whole insurance industry and my frustrations and answer questions that people have, or bring up questions that I get in the office a lot about copays, deductibles. So I'm going to say that. But you got to trust us, okay? Me, other physical therapists, when we tell you 3 times a week, 2 times a week, there is a method to the madness on why we're trying to help you. Sure, this is our career. We do make some money doing this, okay? But you got to understand, our intention is to get you feeling better, okay? What helps us in the long run is not the extra $20, $30 I get on my copay, all right? I want you to feel better, okay? If you want to look at it as a money or business standpoint, is I want you to get better, And I want you, when you leave my office, when someone brings up, hey, I hurt my back, I hurt my knee, I hurt my shoulder, you see whoever you're seeing, okay? This is not an infomercial for my office, okay? So if you're seeing physical therapists, massage therapists, other chiropractors, go recommend them, okay? Some of you may be watching this video, okay? But we want you to go out there and tell, all right? We want you to say, hey, look, give this guy a chance, all right? That's the big picture, okay? It's not to get $40 more from Mr. Jones, okay, because of his knee, all right? If you don't believe me, that is fine. Any of my videos I produce, and I'm probably going to say this many, many times, you don't have to believe me, okay? You can ask other practitioners. You can even say, hey, I saw this guy with this video, okay, and he said that. Is that true? I'm sure 99% are going to bring that up, okay? The 3, sometimes 4, if it's really traumatic accident, it could be 5 times a week. There is a reason. Now, again, but I should mention to you, though, if you do go to an office, okay, especially in my field, all right, and they're looking beyond 4-week intervals. Okay, now listen, if they say 8 weeks, 6 weeks, no big deal, all right? If you go to an office and they're evaluating you and they're giving you a diagnosis, okay, and they tell you such and such is wrong, and they're telling you, it could be once a week, okay? I have patients that come in 3 times a week. We go to 2 times, 1 time. Some patients, very mild issues, okay? Maybe they just get complimentary care. We go once a week. So it's not always 3 times a week in the beginning. But if you go to an office, okay, and they tell you, and they're forecasting 3-6 months down the road, okay, meaning, hey, Mrs. Smith, you strained your back lifting something. You need to come see me 3 times a week for the next 6 months, okay? You run for the hills. Okay, it doesn't mean in some issues you may wind up needing 6 months of care. Okay, but if they're already predicting the amount of times a week over 6 months, run. Okay, but the terminology, and it may not be exactly the way I'm telling you, is they should tell you maybe 3 times a week. Okay, for 4 weeks. Let's reevaluate you around 4 weeks. Okay. All right, and I'm going to go into videos on what to expect after you start getting treatment, sometimes feeling a little worse later. I'll save that for another video. Okay, but they should maybe say 3 times a week for 4 weeks. Let's reevaluate you. Maybe you're doing really well. Maybe you only need twice a week then. Okay, maybe we need to add more strengthening. Then we'll say we'll reevaluate you. Maybe we'll do 2 times a week for a month, or 1 time a week, or maybe you are ready to be discharged. Okay, you go to an office that starts forecasting what you're going to be 6 months from now, okay, or a year, and they start wanting to pay money or whatever. Run for the hills, or call me, or email me, and I'll give you my opinion on that, okay? Now again, when I say a month, month, 6 weeks, 2 months, I would say probably tops, but they shouldn't be forecasting that far down. And depending on the injuries, it may take longer, but again, the other thing I'll say for the video. So again, 3, when you see your doctor and they tell you 3 times a week, I hope you get a little better idea why we do it, okay? Injuries, whether they're chronic or acute, chronic meaning longer, kind of gradually came on, or maybe they came on initially and you've had chronic issues over a long period of time, or acute, like you was in a car accident right away, was within, there's different parameters, there's different courses of care, and there's different algorithms that we follow, okay? It's not money driven, okay? That example I gave you when they forecast may be money driven, okay? But I can promise you, okay, that is not the initial intention, okay? So yeah, hopefully that was helpful. Again, I'm going to probably post this video somewhere. I am not a professional videographer. I'm using very basic stuff. Hopefully the videos I come up, if anything, it helps me out, okay? Because I have a lot of topics that, I get very passionate about. Some of them I'm going to be flailing my arms all over the place and really start going over things. I already got them running through my head right now. But I wanted to address that because that is something that I see on an everyday basis. Not all my videos are going to be about patients or things that I brought up here. There may be things with health and wellness, maybe insurance, okay? But again, just something to digest right now. And then if you're really interested or intrigued, I will do other videos, or you can always shoot me an email, those of you who know me, and I can do something. Because I know I have a million questions from people about understanding co-pays, deductibles, premiums, and really what's been happening with healthcare. And as well as I have people that are just worried, they just want to know about stretching, or they want to know about, what's all this stuff about hot packs and cold packs and when to use them. Okay, so again, guys, thanks for tolerating my video. I'm going to try to always keep them within 10 to 15 minutes. We're right at the cusp of 15 now. So again, have a great day. Thanks a lot for listening.